Diabetes in kids and energy drinks. We've got concerns there. We've got a lot of health issues affecting families in North Texas. Dr. Crystal Foster with Baylor Healthcare System joins us in studio. Always good to see you.
Oh, thank you.
The cases with diabetes, this is kind of scary. The jump in children who've had both type 1 and type 2 since 2000 is remarkable.
It is. It is. For type 1 diabetes, it's increased by 20%. And type 1 is a juvenile onset typical autoimmune cause of diabetes, whereas type 2 is typically adult onset diabetes associated with obesity, and that one has jumped 30% alone since 2000.
So again, we've been watching children's obesity levels, and it's been interesting to see the response from the government to try to get kids to move again. But the autoimmune version, the type 1 version, no answer there as to why the jump.
Not quite. They're thinking that we're changing our microbiome, the amount of bacteria that we have in our body. We're thinking because we're using more antibiotics that it's making us more sterile, and that has some link to it, but it's definitely not a proven cause.
Wow. Well, let's talk more about children. Concerns have been around for some time that children should not be drinking energy drinks, but is there a new worry?
There is a new worry. There's actually a study out of the University of Missouri that showed that people or children who drink sports drinks and energy drinks tended to have more risky behaviors like cigarette smoking or watching television or playing video games for longer periods of time, which was really odd. And the authors of the study can't quite understand why the association is there, but there was a clear association amongst 3,000 children who were interviewed for this study.
Could it be the guarana or the taurine or the caffeine? I mean, I know they have a lot of things in different energy drinks, but we'll have to wait and see if there's more science behind that.
Yeah.
Plus, pregnancy brain, it's real. It's not a myth.
No, it's not a myth. And there have been so many studies in the last 10 years that have shown that there are differences in pregnant women's brains. But there's a new study out of London that showed that pregnant women, compared to new moms, use more of the right side of the brain. Now, the right side of the brain is the subjective side of the brain, the one that looks more at emotions as opposed to analytical. And what they did was show pregnant women two different faces. One was a neutral face, one had more emotion on it, and pregnant women responded more to the emotional face as opposed to new moms, which is an adaptive method, you know, because children can't talk, babies can't talk. So new moms respond more to their emotional, their facial expressions as opposed to new mothers.
Saying pregnant women are emotional? Come on.
How could that be?
That's just crazy talk. Dr. Foster, always good to see you.
Thank you for having me.